Looks like Aaron could use an emergency medical physician. Hurry, here's the award.
Quick, let's get her on the table.
Sure. She's on the table.
Yeah, good job.
Alright, go call the ER team. Dr. Sam, I have to ask you a few questions for my medical report.
Sure, go right ahead.
What is the working environment like of an emergency medical physician?
Well, on a daily basis, anything can happen, so it could be very stressful. And I usually work long hours and don't have anything else to say.
Oh, well, what would you consider to be the nature of an emergency medical physician's career?
What do you mean the nature?
Like, what's it like?
I mean, I enjoy it, but on some days it can be quite stressful. Like today, I have a patient bleeding out internally, and I have to fix it.
There are a few more questions, if you wouldn't mind. What is the salary range of an emergency medical physician?
Well, I don't know exactly, but I make around $200,000 a year.
Really? Very interesting. What is the job outlook of an emergency medical physician?
I think it's supposed to grow 18% within like the next 20 years or something.
Oh, wow.
Yeah, it's pretty impressive numbers.
What is the advancement of emergency medical physician in this day's world?
You have to work your way up. Most people start out as an RN registered nurse, and then work their way up to an ER physician, and then you have supervisor, and then shift leader, and all that good stuff.
Oh, very interesting.
Yeah.
Alright, just a few more questions if you wouldn't mind. Only about 20 more. What is the job schedule of an emergency medical physician?
Well, I work the second shift, which is 8 hours from 2 to 8, or no, 2 to 10, sorry.
I know. It's that time of the day. Why'd you want to become an emergency medical physician?
Well, I've always kind of liked the high stress nature of it.
Dr. Sam, what are the pros and cons of being an emergency medical physician?
Well, there are ups and downs to every job. Some of the perks of this job is saving people's lives and just knowing that when I go to work I have a purpose. Well, some of the downsides are long hours and a lot of work. Always constantly working. If I'm not saving somebody's life, I'm typing an essay for some report. Just like that. Which, it's not fun. So I feel for you. Is that all?
Yeah.
Okay, well, can you get out of my OR? I'm pretty busy and you're distracting me. That means now.
Hi.
I'm Sam Watson.
Renee James, pleasure.
I'm with Fox News, and I wanted to ask you a few questions about your career.
Absolutely.
Well, first off, can you tell us what your career is?
Sure. Well, currently I work for Carolina's healthcare system. It's the third largest healthcare system within the United States. It is not only one of the largest, but the fastest growing healthcare systems, and I'm currently a nurse manager with 150 employees within my realm, in my scope of practice.
Awesome. Well, could you tell us why you chose the job you have?
Personally, I chose this job because I love caring for patients, and I don't think there's any greater satisfaction in life than helping people, whether they're dying or they learn they have a terminal cancer or the birth of a child. So for me personally, it was caring for patients, but also in the nursing profession, there's so much room for growth. You never have to leave the healthcare profession. You can do 3 years in oncology, then you can, once you get tired of that, you can go to 4 years in trauma, and then 4 years with babies and peds. So there really is an entire career, an entire lifetime based in the medical profession where you can continue to grow and excel and never get bored.
Oh, thank you. Well, on a daily basis, what do you do?
When I was bedside or as a nurse manager?
Bedside.
Bedside. So I actually ran the trauma center at CMC Maine, which is a level 1 trauma center. It's the only level 1 trauma center within the Charlotte region, which means we get the worst of the worst casualties. Probably before your generation, the best way I can explain it is MASH. If you ever watched MASH, the TV show, the war. You know, we set up tents, we did triage. You have patients coming in with brain hanging out, bladder, belly, abdomen hanging out, and the clock starts ticking, and it's a matter of life and death. And for me, it was an adrenaline rush to work the trauma center, to run the trauma center, to save the patient before they died. So for me, trauma was my first love, and then critical care.
Awesome. Well, what training / education did you have to get this job?
There's actually a lot of different varieties for nursing. You can get an associate's degree, which is a 2-year degree. You can get a bachelor's degree, which I actually have a bachelor's, and now I'm working on my master's.
Okay.
So different varieties.
And then, would you recommend this pathway to anybody?
Without question. As a matter of fact, I'm rearing my children to be in the medical profession. But if I had to do over again, I would honestly say I would be a pharmacist.